Hello, for my signature project, I have chosen to address the relationship between PECS, the Picture Exchange Communication System, and classroom behavior. So in creating my study, I chose to address the problem of disruptive classroom behavior by students with language delays in the preschool inclusion classroom setting. I do teach in a preschool inclusion classroom. I've seen a lot of this firsthand, where students do display disruptive behaviors, and often this is because they don't have the skills to communicate effectively. So my research question became, what impact does the use of PECS have on the behavior of students with language delays in the elementary setting? And my hypothesis is that I expect to see a significant decrease in problem behavior as PECS usage increases, because just based on my own anecdotal experience, a lot of times when these students do have a way to tell us what they want, their behavior gets better. So I turned my attention to the literature, and I found quite a few studies that did support this link between decreasing problem behaviors as PECS usage increases. Che and Lieberman-Betts in 2016 found that for their subject Sarah, as her PECS usage increased, which is marked by the squares on the graph, her problem behavior of crying, marked by the triangles, decreased, and her length of time at the table, marked by the circles, increased. So as her negative behavior decreased, her positive behavior increased as she learned to use PECS more effectively. Hu and Lee found a similar result for their subject, Coco. So as Coco's PECS usage increased, which is marked by the black circles, the aggressive behavior, marked by the white squares, decreased. And also vocal commands, which are verbal requests, increased as well. So I think that's a cool thing that they kind of found in addition, that as Coco learned to use PECS more effectively, communication in other ways also increased. And I found some other studies that also found that these things were linked. Anderson, Freya, and Cornelius Hatterad saw decreased problem behavior with the use of PECS, and Durand found decreased problem behavior with the use of a communication device. So for my study, I would choose a small group of about 8 preschool age students, ages 3 and 4, with developmental disabilities, including language delays and problem classroom behaviors. So they would need to have both the limited communication and the problematic behavior. And then defining that a bit further, I define language delay as a child obtaining a score less than 70 on the Battelle Developmental Inventory within the last 2 years. And problem behaviors are defined as leaving the designated area, throwing small items, loud vocalizations like yelling or screaming, dropping to the floor, and hitting others. So they would need to just show any of those problem behaviors in at least 25% of 5-minute intervals on 80% of days over at least a 1-month period. So it would need to be a pretty consistent pattern of problem behavior. But if students meet all of those criteria, they would qualify to participate in the study. And of course, I would keep confidentiality in mind. I would get permission from my school district, the IRB, and the parents of each student. Parents would be informed about everything I plan to do, and they would have the option to withdraw their child from the study at any time. And when publishing my results, I would not include student names or anything that could possibly identify them. So the study itself would have 3 phases. The first phase would be baseline data collection. And all I'm doing during this portion is just saying, how often am I seeing these problem behaviors from these students? So I would collect behavior data using an interval data collection form, which is pretty simple. It's essentially just a list of the time intervals in a student's day. So 8 to 8:15, 8:15 to 8:30, 8:30 to 8:45, and so on, all the way through, and it's designed for a teacher or an aide to just be able to quickly mark behaviors as they happen. So if a child hits another child at 8 o'clock, you would put an H next to the 8 to 8:15 time slot, and so on. So once I had 4 weeks of that data for all subjects in the study, I would move to phase 2, which is PECS training. So each child would have at least 60 minutes weekly of discrete trial instruction on the use of PECS, and this is just repetitive explicit instruction on using the picture exchange communication system. And for young children, typically that involves fading prompts. So we would start with full hand-over-hand assistance, saying, okay, what do you want? Do you want goldfish? Give me goldfish. And then putting their hand on the picture of the goldfish crackers, hand over hand, getting them to give it to an adult, and then giving them the goldfish. And working with those preferred items is always reinforcing for young children. Usually that's food or toys. And so we would slowly back that full prompt off to maybe just a verbal prompt. What do you want? Give me goldfish. Or a gestural prompt, just pointing to the communication board. So students who reach mastery, which I've defined here as manding or requesting at least 5 times successfully each day without physical prompting, have been are considered to have mastered the PECS system, and they would move to phase 3. So in phase 3, this is another 4 weeks where I would collect data on both how often are they using PECS, so are they maintaining that mastery level of 5 successful requests per day, and I would also collect data on their behavior, exactly the same way I did in phase 1, so 4 weeks of interval data collection. And so then I would be able to compare the behavior data collected in phase 1 to the behavior data collected in phase 3. And there are 4 possible results that I could find when I look at those 2 sets of data. The first one is that behavior would either stay the same or increase while PECS mastery was maintained. So they know how to use PECS, but behavior is not getting better. We're still seeing these problem behaviors. I would interpret that to mean that PECS would not be an effective behavioral intervention for that child. The second possible result is that behavior either stays the same or increases while PECS mastery is not maintained. So they're really not effectively using PECS, and we're still seeing these problem behaviors. So that would tell me that they probably just need some more instruction on PECS in order to really solidly know how to use it. But that wouldn't really tell me whether it helped with their behavior or not. So that would be kind of an inconclusive result. The third possible result is a decrease in behavior while PECS mastery is not maintained. So their behavior is getting better, but it's not because they're using PECS. That would also be inconclusive because that would tell me that the behavior change is due to some outside factor, not the PECS instruction. And then the last result is the one I'm hoping to see, which is that behavior decreases while the student maintains their mastery of PECS. That would tell me that, okay, PECS is an effective behavioral intervention for this student. Because they know how to communicate, their behavior is improving. And so just kind of restating that here, I do expect to find that as PECS use increases, problem behaviors decrease. In conducting this study, I hope to provide some additional research support for the idea that yes, PECS is beneficial to students in the special education classroom, not only because it helps them communicate, but also because it helps decrease those problematic and disruptive classroom behaviors. And so it should be something that special educators consider when they're trying to improve student behaviors within their classroom. So that is my proposal. Thank you so much for your time.